One of the other decisions is, and thoughts about breast implant placement is either under or over the muscle. So putting a breast implant under the muscle has some benefits versus going above the muscle. Going above the muscle, we would generally reserve for patients who are professional athletes, professional bodybuilders, and body models who are worried about a couple of things. One, they're generally worried about things like animation. So with the breast implant that goes under the muscle, potentially every time you flex your pec muscles, that breast implant might move a little bit. That risk can be minimized technically intraoperatively by dividing part of that muscle as it inserts along the medial part of the chest wall. But by putting that over the muscle in some circumstances, particularly for bodybuilders, losing part of that pec major insertion potentially is detrimental. So they tend to, those patients tend to go above the muscle. Going under the muscle is probably the most common. It secures the implant in place. It does provide a more natural view or more natural shape for the breast. And it tends to be a lot more predictable in terms of the outcome. There are fewer complications going under the muscle. Things like double bubbles, double capsules, that sort of common issue is minimized by going under the muscle. It tends to soften the edges. So going under the muscle is a more natural appearance because it does soften the edges of the implant. There are some people that say that you lose volume by going under the muscle, and it's a not really, I guess, is the short term of that. You don't. The volume that you get in an implant is always maintained because it's just that's the volume that's there. By going under the muscle, that volume is the exact same amount. You're not really losing anything. If anything, you just soften it out and make it less obvious. So the issue with going over the muscle is the implant becomes more obvious. So it does become a more obvious look. Again, nothing wrong with that, but it's entirely patient, it's entirely someone's preference. To have the done look, something that's very obvious, you don't have to go above the muscle. The problem with putting a large implant above the muscle is that there is always a risk of something called symastia, and that's where the implants will make their way towards the middle and you end up with implants touching at the midline. And that's a real problem, and it's very difficult to fix. But more importantly, it's a really strange looking view of someone's breast to have these two implants sticking in the middle. And that risk is higher if you put implants above the muscle. So below the muscle, there's a safety factor for implant placement, safety factor to make sure that doesn't happen. There are risks of going under the muscle, under the breast tissue rather than under the muscle. So if you go above the muscle, because the breast is that slightly bit closer to the breast tissue, there is a small risk that they can get infected during breastfeeding. So breastfeeding is a time when there is an increased risk of something called mastitis or inflammation within the breasts themselves, and that risk is certainly higher in the first few weeks after pregnancy. During that time, during a period of mastitis, there's bacteria that are obviously floating around the breast, and if your breast implants are near that breast tissue, it's just a very, very high risk that they can get infected. If they're under the muscle, there's just that extra layer of tissue that protects them, and that risk does decrease in that circumstance. I think it depends on what their goals are. So I think if they're thinking of getting pregnant within the next year, I would probably hold off for a few reasons. One, obviously during pregnancy and subsequent breastfeeding, the breasts will swell and they can change shape quite significantly. There's always that risk of things like infection and the potential risk of an inability to breastfeed. Obviously with breastfeeding, everyone's breasts do something different. Some swell a lot, they get very large during the lactation period, and as a result there can be a lot of ptosis, meaning the breasts can actually fall, they get a bit saggy, and then you might need to come back and do a mastopexy down the road. With a breast implant in there, it just means that initially the breasts won't look fantastic, and certainly if you wanted to come back and get a lift and an augment at that time, that's perfectly reasonable.